was 1945. The war was ending. Men were coming home, and across America, women were going to prenatal clinics, trusting the doctors who smiled at them from across clean white desks and handed them paper cups. Drink this, they were told. It's good for the baby, and so they drank. They didn't know it was radioactive. They didn't know they were part of an experiment. And for some of them, the worst part is, neither did their children. To understand what happened in Nashville, Tennessee, you have to understand the mood of 1945 America. The atomic bomb had just dropped on Hiroshima and Nagasaki. Radiation was the future. It was science. And more importantly, it was power. The men who worked with it were treated like gods, alchemists of the modern age, bending matter itself to human will. And the federal government was hungry for data. Specifically, what does radiation do to the human body? The U.S. Public Health Service began funding a wave of research institutions, universities, hospitals, military laboratories. The mandate was simple. If unspoken, learn everything. No budget was too large. No subject matter was too sensitive, and apparently no subject was too vulnerable. At Vanderbilt University in Nashville, a respected institution with a prestigious medical school, researchers saw an opportunity. They had access to something valuable, or pregnant women. Vanderbilt ran a free prenatal clinic. Women who couldn't afford private care came here. Working class women, women with few options, women who trusted that a prestigious university hospital would care for them. Between 1945 and 1947, researchers enrolled roughly 129 of them in what they called a nutrition study. The lead researcher was Dr. Paul Hahn. His stated goal, to measure how efficiently pregnant women absorb iron. Iron deficiency anemia was a real concern at the time. The research wasn't entirely without scientific merit, but here's where it crosses a line that cannot be uncrossed. To track the iron, to make it traceable, Hahn and his team used a radioactive isotope, Fe-59. A gamma-emitting radionuclide. They mixed it into a drink, called it a cocktail. When the women came in for their second prenatal visit, they were handed this drink. Some accounts suggest they were told it was a large vitamin supplement. Some suggest they were told nothing at all. What is absolutely documented, none of them were told it was radioactive. None were told they were subjects in an experiment. None gave informed consent because no one asked for it. They drank, and then they went home, back to their lives, carrying the experiment inside them. The fetal dose of radiation delivered varied between 200,000 and 1 million countable counts per minute of radioactive material. The researchers drew blood from the women on the third visit. They examined the blood of the newborns at birth. They recorded everything. Everything, that is, except the names of the women they had harmed. For years, nothing seemed wrong. Or rather, things went wrong, but nobody connected the dots. Women reported rashes, bruising, tooth loss, hair falling out in clumps, fatigue that didn't lift. These are the calling cards of radiation exposure, though the women wouldn't have recognized them as such. Nobody told them to look out for these signs. Nobody called them. Nobody followed up. And then the children began to get sick. The Advisory Committee on Human Radiation Experiments, convened decades later, documented the outcomes with clinical precision. 4 children born to mothers in the exposed group developed malignant cancers. 4 in a group of roughly 679 exposed children followed in the study. The cancers were acute lymphatic leukemia, synovial sarcoma, lymphosarcoma, primary liver carcinoma. In the control group, children born to mothers who had not received the radioactive cocktail. There were 0 such cancers. The statistical probability of seeing 3 or more such cases by chance, given what you would expect in that population, was calculated at 3 in 1,000. The researchers' own conclusion: the data was suggestive of a cause and effect relationship. One of those children was Carolyn Croft. Her mother, Emma, had trusted the Vanderbilt clinic. She had done everything right. She had drunk what they gave her because they told her it was good for the baby. Carolyn died of cancer at age 11. The year was 1959. For years, Emma Croft believed it was God's will. She didn't learn the truth until decades later, when journalists began pulling classified documents out of the dark. Here's where the story turns from tragedy into something much colder. In 1963, 16 years after the experiment ended, a new team of Vanderbilt researchers received grants from the Public Health Service and the Atomic Energy Commission to do a follow-up study of the exposed children. They located records of 751 of the women who had been given radioactive iron. They found their children. They sent out questionnaires. But the questionnaires did not mention radiation. They referenced the original nutrition study, but gave no indication that the researchers suspected radiation was causing cancer deaths they were now quietly documenting. These women and their children were being studied again without being told the truth. And here's the detail that may disturb you the most. By the 1970s, Vanderbilt University had lost most of the original records. About 320 women from the study were known to still be alive, but the files that would have told researchers and the women themselves exactly who had received the radioactive dose and who had been in the control group, gone. A Vanderbilt spokesman later told the Washington Post, "The researchers maintained their own files. They were not Vanderbilt property. They belonged to the researchers themselves." The researchers had destroyed them. The pregnant women were not the only subjects. A separate 1945 study, less documented but no less disturbing, involved 188 elementary school children who were given lemonade laced with radioactive iron to measure their nutritional needs. Children were handed cups of radioactive lemonade, children who could not consent, and children whose parents were not told. This was not an aberration, it was part of a pattern. Across America, during the same era, researchers at MIT fed radioactive oatmeal to mentally disabled children at the Fernald State School, telling them they were joining a science club. At Columbia University, terminally ill patients were injected with the radioactive calcium and strontium. At hospitals in Massachusetts, uranium was injected into patients. The federal government funded all of it. The Vanderbilt study, as large as it was, 829 subjects, was not even the most extreme example. It was simply the one that happened to pregnant women. Mothers. Women who came to a free clinic because they had no other options. The vulnerable were always the subjects. That was never an accident. The story might have remained buried forever, but in 1993, an Albuquerque journalist named Eileen Wellsome began pulling threads. Her reporting on classified government radiation experiments conducted across the United States won the Pulitzer Prize and forced a national reckoning. President Bill Clinton established the Advisory Committee on Human Radiation Experiments, ACHRE. Its mandate was to investigate the full scope of what had been done. Emma Kraft testified before the Advisory Committee. She told them about Carolyn, about the clinic, about the cocktail she had been handed and told to drink. An attorney described her in front of the committee.
She had believed for years that her daughter's cancer was God's will. It wasn't until recently that she came to believe, based on medical evidence, that this tragedy happened for no reason, that it wasn't an act of God. It was the intervention of humankind, and it was done without her consent.
In 1994, former subjects filed a class action lawsuit against Vanderbilt University, the Rockefeller Foundation, which had co-funded the research, and the state of Tennessee. Vanderbilt denied wrongdoing. Their associate vice chancellor stated that the researchers believed that the dose was safe at the time, that this would not be acceptable today, but, here is the phrase they chose, it was carefully evaluated. In 1998, a federal judge gave preliminary approval to a $10 million settlement. Vanderbilt paid, it issued an apology. No amount of money brought Carolyn Kraft back. No settlement reversed an 11-year-old girl's death from leukemia. There are questions that were never fully resolved. Why were only poor women enrolled? Why were working class women, women with no access to private care, the chosen subjects? The researchers did not enroll their own wives. They did not enroll women with options. The timing is notable. Just as congressional investigations into government experiments were beginning to gain steam, just as accountability was about to be a real possibility, the files that could have identified the individual women and their doses disappeared. And perhaps most haunting of all, the follow-up researchers, who in 1963 quietly documented that children in the exposed group were developing a cancer at a catastrophically higher rate than expected. They concluded the data suggested a cause and effect relationship. And then, the study was published. Then nothing happened. No women were notified. No children were warned, no one picked up the phone. The Nuremberg Code, which established the foundational rules of medical ethics and the requirement for informed consent, was published in 1947. The Vanderbilt experiments began in 1945. Some of the administration of radioactive iron continued into 1947. The code existed, and yet the experiments continued. Emma sat in front of a Senate committee in January of 1994 and told them her daughter's name. She said it clearly. Carolyn, 11 years old, 1959.